Imagine a mother sitting in the back of an ambulance, her heart racing, as she clutches her child's hand after a terrible accident. Right now, she has hope, because our hospital is minutes away and our team is ready. She knows this because we've done it before. Like when a young boy critically injured in a crash was not only saved here, but went on to fully recover at DuPont. Today, he's back at school, surrounded by his friends, living the life his family feared he might never see. Picture a father receiving the call that his teenage daughter has been shot on New Year's Eve. It's the nightmare no parent wants. But when she arrived at our trauma center, she was in the operating room within minutes. Our team's swift actions meant her father got to hold his daughter again, alive and healing. And think about the young man who came to us with a stab wound to the heart. When his heart stopped, our team didn't. They brought him back, and he walked out of our hospital. Stories like this are why our community feels safe knowing we're here. But it's not just about emergencies. Our hospital is the largest provider of psychiatric care in Delaware County. For those struggling with mental illness, we are often the only place to find the support they need. We are the safety net, the place where hope is restored and lives are rebuilt. We are the only burn center in the region providing specialized burn care. If our hospital closes, these stories could take a tragic turn. Those tales of survival could be obituaries. The mother in the ambulance might not make it to the next hospital in time. The father might not have a chance to see his daughter recover. The young man with a stab wound might not get a second chance. Closing our hospital would create a void no other facility can fill. It would leave our community vulnerable without the trauma, burn, and psychiatric care that has saved countless lives. Our hospital is more than just a building. It is the beating heart of our community. And when a heart stops, everything changes. The closure of our hospital would not only devastate our community's access to the critical health care, but also directly impact the lives of 3,000 dedicated employees who call this place their professional home. These are not just workers, they are caregivers, neighbors, and friends who have devoted their careers to serving an underserved community. Many of them just minutes away, and for years, they have walked through our hospital doors each day with a singular purpose: to make a difference. Imagine the ripple effect of 3,000 jobs lost. They aren't just paychecks disappearing, they are livelihoods. They are parents who will have to sit down with their children and explain why Christmas might look different this year, why soccer leagues and dance class might have to wait. How do you explain to a child that you lost your job because the very hospital where you saved lives, comforted families, and worked tirelessly to the community is no longer there? For so many of us, this hospital isn't just where we work, it's where we find purpose. It's where we've built lasting relationships with our patients, celebrated recoveries, and mourned losses together. It's where our colleagues feel like family and where our commitment to our community goes beyond professional duty. The people who work here aren't just healthcare providers, they are advocates for the community. They know their patients not just by medical charts, but by name, by story, by shared moments of humanity. They are the faces patients look in for times of crisis, the voices of comfort, and the hands that heal. Their passion for providing care to this community is not just a job, it's a calling. Closing our hospital would mean 3,000 stories of uncertainty and hardship. It would mean uprooting families, losing health insurance, and facing financial struggles in a region already in need. It would mean losing not only the services we provide, but the heart and soul of the community. The impact on our employees is not just economic, it's deeply personal. It's the loss of identity for those who have spent decades in these halls, who have made their hospital their second home. We are more than a healthcare institution. We are a cornerstone of this community. And if this hospital closes, it won't just break our hearts, it will break the spirit of an entire community.